Hey everyone, good afternoon. This is County Executive Pat Ryan. Thank you for taking some time away from sledding or snowman building to join me for the COVID update this Tuesday afternoon. I'm going to talk a little bit about the current state of COVID virus infection and rate in the county, as well as our vaccination progress, and also a few other exciting and encouraging items to share about broader things happening in the county. Before I do that, I do want to, in a more serious note, say that I hope everybody is doing well after a very significant snowstorm. We've had no reports of any major issues. I especially want to thank our county public works and road crews and all the folks out there still working right now to clear snow from roads and sidewalks. This was a really long duration and, of course, high intensity and high accumulation storm. So we've had crews out there now for almost 36 plus going on 48 hours working to get our roads, and at least my commute this morning, the roads look in really good shape throughout the county. So I really want to thank our road crews for their work. Hopefully they're going to get a chance to rest up here shortly, if not already. I want to also just give a quick update on total accumulations that we're tracking through the National Weather Service. Again, this was a very significant storm. Saugerties has earned the, I don't know if it's a positive or negative distinction, but the distinction of the highest reported snowfall total in the county, 25.6 inches in Saugerties, which is pretty significant, obviously. 19 inches in Esopus, 18.1 inches in Phoenicia, and 14.2 inches in Kingston, and generally seeing a slight, kind of higher totals a little bit further north and declining as you go south a bit. So again, thank you to everybody that has worked and is working to get us through the storm. Minimal power outages as well, encouragingly, even though we did have some high winds last night. So once again, I'm proud of our collective team, Ulster County, in responding to another major snowstorm. And now we'll get back to the other things happening in the county. On the COVID situation, two high-level updates. First, we are beginning to see now finally a sustained dip in COVID-19 infection rates in Ulster County. This is the first time in several months that we are now below 5% new infection rate. We're at a 4.62% new infection rate over the last few days. So that is a relative positive sign. The other relative positive sign is we are continuing this week to see an increase in total vaccine allocation, although to just be very clear, and I know many of you are experiencing this, we still have far, far less than we need, but each week we are receiving a little bit more from the state, and hoping that the work happening at the federal level will really ramp up what we can get out to folks across the county. Diving into the data more deeply, total cumulative cases in the county now at 9,629 since the beginning of the pandemic. We've tested 247,000 plus tests. Again, far more than the number of residents that we actually have in the county. Fortunately, 7,037 recovered, and tragically now 213 of our neighbors, friends, colleagues, family members, loved ones have succumbed to COVID. That is 4 additional fatalities since our last update on Thursday, so continuing at 1 fatality per day or more. And unfortunately, January was, as I've said before, by far the worst month in terms of loss of life from COVID. The cumulative total for the month of January in Ulster County was 72, meaning that a third of our total fatalities through the whole pandemic just happened in this last month. And until we can get these infection rates down and the hospitalizations down, we are at risk of continuing to see those losses. And so it is absolutely a life or death matter in terms of continuing to follow the precautions and using using the information from the public health experts to keep yourself safe and others safe. So that is still very much the case. Hospitalizations, and I apologize, there's some of our first responders out right now if you hear that in the background. Hospitalizations are holding about steady. We are at 35 hospitalized in Ulster County right now, 5 in the ICU. That is up slightly from last update where we were at 32, but as you can see on the graph, we've been holding about steady in the low 30s now for several weeks, and that's one of the many metrics that we need to continue to work to get down. Hopefully we'll start to see the hospitalization rate come down correspondingly as we've seen the new infection rate start to come down. Active cases are also still at a very high level at 2379, but we are beginning, as you can see, again on the graph, to see a little bit of a dip there from the very high over 2,500. And again, encouraging signs that this reduction will hold, and even that we'll continue to see additional reductions in active case count if everyone continues to follow those precautions. New positive rate, I talked about this a little bit up front, but in the last 96 hours since our update, we have tested 5,473, and had 253 new positive cases. That puts us once again at a 4.6% new infection rate. That is one of the most encouraging signs we've seen to finally get below 5%, and let's continue to work to bring that down and down and down to where we were in the late spring and summer, where we were under 1%. That is a much more manageable rate where we can really still have COVID out there, but keep folks from passing away and getting extremely sick as they are at the rate right now. Finally, looking at the projections out longer term, you can see here, as always, best, middle, and worst case. We are, with the new infection rate, optimistic that we can start to flatten that curve back down again and collectively get this back under control, get this second wave, finally get through this second wave and get COVID back under control. Hospital beds, we are at 35 hospitalized, 5 in the ICU, and as you can see, more than sufficient need for, or capacity for the need. ICU beds are a little bit close, but once again, as I've said before, in working with our local hospitals, we can add more ICU capacity if needed. It's more of a staffing issue than it is an equipment issue. So if we did start to see the ICU numbers get tight, our hospitals are able to ramp that up as well, and they and us are closely monitoring that. So how do we continue to keep, finally we have the directions headed the way we want. We have new infection rates going down, we have vaccination numbers going up, albeit at a much slower rate than we'd like. How do we keep those directions headed the way that we want and that they need to be headed? That is up to us collectively to make sure that almost a year in, I know, but that we continue to follow those precautions. I think about the fact that we're heading into another sort of, not holiday, but almost some American version of a holiday, with the Super Bowl coming up this next weekend. And I know that that's, again, an opportunity where people get together. They hang out in a small room indoors for many hours. They scream and yell and either celebrate or commiserate. That is very much a high-risk activity. And I know that's something that we all like to do, but would really ask people to try to not do those kinds of gatherings and other social gatherings. If you absolutely feel compelled to get together with friends and you can't definitively know that they're negative or that they haven't been exposed, then I know it might not be ideal, but even considering wearing a mask indoors, that's what many of us are doing at our workplaces if we do have to work. That is, if you absolutely have to, which I would say you should think about that. But if you absolutely have to, being armed with the information to know that at least masks and distancing and minimizing the time that you are together, and if possible, having ventilation. We know from all the science now and health experts at this point that really the aerosolization of the virus means that it's not just about surfaces, but it's about sharing air or swapping air, which sounds kind of gross. But that's really how we know COVID is being transmitted. So when you're putting yourself in a situation to do that, you're putting yourself at risk, you're putting your loved ones at risk, and you're putting the whole community really at risk. So please continue to follow those precautions: mask wearing, social distancing, and avoiding gatherings, and washing hands. Shifting to, did that spoil your Super Bowl fun enough? I hope. I hate to be the downer, but that's part of the job here, so thanks for bearing with that. Shifting to the vaccine situation, as I said, relatively encouraging news in Ulster County this week. We have been allocated now 1,900 total doses for Ulster County. Last week we were at 1,500. The week before we were at 1,300. The week before that we were at 1,100. So we are, thanks to the state and the federal government, we are seeing more, but it is not near enough. The increase from last week to this week is significant. It represents an 18+% increase, so we are thankful for that, and I think it's important that, as frustrating as it is that we can't get everybody vaccinated, we should take some solace and some comfort in the fact that week on week, we here have been able to consistently up the total numbers, and that we will continue to do that, and that everybody at every level is now working to make that happen. That being said, we know that we desperately need more vaccines, and we need them now. We needed them yesterday and weeks ago. We have tens of thousands eligible, about between 60 and 70,000 eligible in the county, and we still have been able to vaccinate less than 20% of that total eligible number, just in the 1A, 1B, and 65 plus categories. We are receiving still a huge volume of calls, emails, texts, tweets about, how do I get vaccines? I want to just actually read two of the messages that I've got literally just this morning, just so that you have a sense, and I know many of you watching are feeling this way too, just so you have a sense of how others are feeling, and to let you know that, I'm feeling this and hearing this as well, and doing everything that we can. One of our residents just about an hour ago, Facebook message: "I'm 78 years old and entitled to the vaccine," meaning eligible for the vaccine, "but I can't find anywhere in Ulster County that is distributing vaccine. Am I missing something? Thank you." And I'll talk about what you need to do to sign up here in a second, but ma'am, you're not missing anything. The reality is although tens of thousands of people are eligible per the rules, we don't have nearly enough to get vaccine to all those people. So that creates, I know, a very difficult and frustrating situation. But the reality is right now in New York and across the country, even though you may be eligible, there's not nearly enough for everybody. So we're doing the best that we can. And I'll talk about it in a moment, but really what you can do is sign up with the county, which many have done, well over 20,000 now, and know that you are signed up, and that as we get it, we will let you know, and that really we have to continue to be patient, which I know isn't what you want to hear, but that unfortunately is the reality of the situation. Another message I got a few hours ago, this one on Twitter: "How do my 70-plus-year-old parents with health issues get the vaccine? They are Ulster County residents, and we've been trying for 3 weeks. What do we do?" Again, it is absolutely just agonizing to have to know that there are so many that are both eligible, but more so living in great anxiety and frustration right now in the county, and that is obviously not acceptable. And here, at the county, I'll tell you what we're doing, but at the state and federal level, they are doing everything they can to ramp up supply. It really is a supply problem. At the county level, what we are doing to at least try to at least communicate what we know, in addition to getting back to everybody that's reaching out as best we can, we have set up our Vaccination Resource Center, which is a sort of a single point where you can go and get information about eligibility and so on. But probably most importantly to most of you, you can sign up, enter your name, your address, your age, any health status, your where you work, so that we know which category you're in. And what that is doing is putting you on a list so that when we get enough and when we do get vaccine, we are notifying those folks that are eligible. The problem, once again, is just a supply and demand mismatch. And I know that isn't, again, what anybody wants to hear, but I think it's important that I'm straightforward with everybody that that's the way it's going to be for several more weeks at least right now, until we can get the supply up. And within the limited supply that we do have, believe me, our team is doing everything we can to ensure that what we do have is getting distributed as quickly as possible. We're usually in a matter of hours getting those doses out that we do receive, and most importantly, that we're doing it equitably. And what does that look like? Among the total allocations, some is set aside for seniors, which is the largest category. Some is set aside for 1A healthcare workers, and some is set aside for 1B, which are other frontline essential workers, first responders, and teachers, for example. So that's one way in which we're making sure all of those eligible categories get a sort of proportional share. Then within those pools, what we're doing is making sure geographically, and especially along demographic categories, in particular race, we're making sure that we are achieving equity within to meet the demographic makeup or better of our county. So last week we had a very successful effort working with church and faith leaders in many of our Latino and Black community churches across the county to proactively go and actually use the churches to get those doses out to folks in need. So again, we're doing everything we can there, and I hear your frustration. Please continue to reach out. I know we may not be able to answer it the way you want, but we'll always tell you what's going on. You can sign up for that if you haven't already at vaccinateulster.com. That's vaccinateulster.com, or through our COVID-19 portal. Just final note on that, we know especially those 65 plus and our seniors have additional boundaries or barriers often around technology and navigating the online systems. So our Office for the Aging has set up a separate call line for anybody 65 plus to call them at 845-340-3456. So if you are a senior in that category, if you're a family member, if possible, use the online form. That is the fastest and easiest, but if needed, you can call our Office for the Aging. If you've signed up, you've done everything that you can right now, and then at this point, again, the best you can do beyond that is continue to be patient and know that everybody is working as hard as we can to get this out based on what the supply that's available. So that's the vaccination update. Changing gears just a little bit, there's obviously many other things happening in our county and in our community. In addition to dealing with the health epidemic and getting the vaccine out, we've been doing a tremendous amount of work on our recovery task force, helping those that have lost their jobs or are suffering economically, at risk of not having food or housing, especially in this winter, at risk of needing substance use disorder help or mental health help. So we're continuing that work. The other thing that we've been doing throughout this year, especially the latter half of the year, is in the midst of the pandemic, doing everything we can to ensure we're making progress on one of my big 5 priorities, which is building a justice system and a criminal justice system that is actually equitable for all in our county. So back in June of 2020, 6-7 months ago, I was proud to create our first ever Justice and Reform Commission in the county, made up of 15 members from across our community, representing all the great aspects of our community and the diversity of our community. They've been working in a series of public meetings and working sessions of the group to examine our justice system now, to find opportunities to improve it, and ultimately to produce a report which we'll be releasing the final report today, actually. So I want to first off, thank the members of that commission who spent a tremendous amount of time. I want to thank hundreds of community members who participated in town halls, who sent suggestions either via email or in our drop boxes back over the summer. I'm really proud of the work that we've done on this, and I think the report really reflects our values as a community and as a county, that we know we have work to do in this regard, really to erase centuries of baked-in racism and inequities in our systems, our justice system, and our particular criminal justice system. So the plan put forth by this group is comprehensive. It's I think 30 to 40 pages. It includes 4 primary sections. I won't go too far into them. I'd invite you to check out the report. But at the high level, the group includes recommendations in the immediate term, the medium term, and the long term over a 5-year plan to do 4 big things with a bunch of supporting efforts underneath them. But ending mass incarceration, strengthening oversight and accountability of our law enforcement entities, addressing systemic racial bias throughout all of our different systems, and healing the relationship and improving the relationship between the public and the police that they're sworn to protect and keep safe. So again, this is the culmination of a great amount of work, and I encourage everybody to check out that report. The next step is that report will be presented by our commission to our county legislature. It'll be reviewed by our 23 legislators, and my hope is that they will agree that this is a great report. I think they will, and that will be approved and codified in the next month or two, which will also meet the timeline set by Governor Cuomo to get that report. I was really proud that in the governor's State of the State address a few weeks ago, he actually shouted out Ulster County as an example of how to do this well, and that's a great credit to everybody that's been part of the process. On a similar note, yesterday we began a very important month in the county. This is Black History Month, and I was very proud, albeit in the midst of our offices being closed, but obviously we were working through that. I was very proud to issue a proclamation just declaring Black History Month in Ulster County as a month for us to, as a community, come together. It may have to be virtually, but to come together in whatever ways we can to examine and work through the history here, as well as celebrate all of the tremendous accomplishments of our Black community now and in the past, and look forward to what is coming. So I think this is a particularly important time and moment to be doing this work, and to really, throughout the month, there are a series of events organized by a whole host of community groups that we'll be participating in and I'll be participating in. I invite you all to do that as well, so stay tuned for more details on that. Another important opportunity for us to continue to do everything we can to get better each and every day across a whole bunch of dimensions here in Ulster County. Finally, as we wrap, thanks for staying with me. This was a little bit of a longer update today. I want to thank all of our frontline workers, now almost a year into the pandemic, continuing to do whatever the different aspects of the work that they're doing at risk to themselves in order to help get our community through this. Thank you for continuing to be to show that selflessness and that spirit of community. I especially want to thank, as I did at the beginning, in the last 48 hours, our essential workers and frontline workers, our public works workers, our road crews in the county, in the city of Kingston, and all of our towns and villages, for your work that you're doing there. And also I want to mention some of the stories I've seen and heard of just neighbors helping neighbors, of someone realizing maybe their next door neighbor's car is buried and they might not be able to shovel themselves out, or they need to clear their driveway, or hey, I can run my snowblower if I'm lucky enough to have one, which I'm not, but if I can run my snowblower to help my neighbor, I'm going to do that. Those are those small things that each of us can do, even in the midst of a period where it feels like a lot is not in our control. Those are the small things each of us can do to just be as positive and supportive of each other as we can during this really challenging time. So I want to thank everybody that's done that. And if you haven't done that and you got a little bit of time, go help your neighbor, see if they need a hand. And let's continue to get through all the aspects of this really challenging period together. Our next update will be on Thursday at 3 p.m. Hopefully we'll continue to see the progress as we've talked about today. If you need anything in the meantime, you can call our Recovery Service Center. That number is 845-443-8888. As always, I want to thank our Radio Kingston team for helping keep you all updated and informed. I want to thank Manuel and Diane as well for helping to interpret. And I want to thank each of you for continuing to tune in, and please share this information with those that might need it. In the meantime, stay safe and healthy and warm and dry and resilient, and we will see you in 48 hours.